but in general, with some of those earlier slides, the source of that information, is that from you, or did you have a professional service put those numbers together? Where did that stuff come from?
That was me. So myself and my staff, we went through a couple thousand audited financials and put it together in a database.
And then and I have a series of questions, Mr. Chair, if you'd be willing to let me just go through those, if I may.
Yes, but just to add further clarity, that data comes from the data that's being reported by the local units. We've simply aggregated it here for this presentation. So that's the data they're reporting. It's their own data.
Okay, thank you.
And proceed.
Thank you. And then with some of those figures, is that factoring in, and maybe you don't know this question, but is that factoring in when municipalities are not paying their fair share? When the funds at a time in the past were well funded, the employees were continually paying in as they were supposed to, but municipalities decided not to pay in because the fund was so well funded at that time. But now it's caught up to them.
No, I mean, because you're talking more of like an income statement that's over a specific time period. This is more of a balance sheet information of a specific date. So,
Okay.
It's really like where are we at today, not necessarily how did we get there.
And then with that same mentality of where we're at today, does it calculate the changes that many municipalities across Michigan are already making because they've recognized that there's an issue, that they have to address it? So they're switching from defined benefit plans to defined contribution plans, which are automatically going to make those unfunded numbers skyrocket because there's not as many people paying into the plan.
Actually, that's not how it works, but I understand your point. But I do agree. That's why I did try to point out for the OPEB that, we did in 10 years move from 0% funded to 30. So that's kind of over a time period, I did try to indicate a trend. So I do think that's positive, yeah.
And then I'm down to two questions, Mr. Chair, if I may. And then specifically in my district, in Muskegon, the cuts in revenue sharing over the last 15 years have amounted to about $32 million. And ironically, that's revenue sharing the money that was coming from the state that municipalities were promised. And ironically, some of the same figures, $32 million, are what's in the unfunded liabilities in those communities. So do you see any kind of correlation between the monies that the state, that we have been cutting over the years and promised revenue sharing to what those unfunded liabilities are actually are?
I think, revenue sharing is kind of a red herring in this issue. I think of the Iona County Road Commission. They're 40% funded, and they never miss their ARC payment. I do think maybe indirectly it does play somewhat of a role, because if you think of it this way, if you look at the Iona County Road, or just road commissions in general, as a whole, they're much farther unfunded than the average. They're in their 50 to 55% average funding ratio for their pension. But if you look at a lot of the medical facilities, they're like in the 90% funded. And this is really more of a theory, but you could maybe argue that the medical facilities have much more cash flow, and the road commissions are much more cash constrained. So maybe indirectly, they push down their annual payments in order to fund other services. But to say directly that a local unit lost $32 million in revenue sharing, and that's what caused $32 million of unfunded liabilities, I can't agree with that assessment.
And then, Mr. Chair, my final question is, you brought up Detroit and Iona County, just a couple of those municipalities that are covered, but there's thousands that are actually still have not gotten to that point, that they're still working with their employees, they're making the changes necessary that they see fit. And one of the things that I heard was consistently from you is that we're looking out for the employees, we're looking out for the retirees. With that mindset, would we as a state government ever want to get involved in corporations? If corporations were having issues with their pensions, would we want to get involved in limiting what they can do?
Well, if a corporation goes bankrupt, there's federal insurance that these pensioners will go into. If a local unit of government and a public pension goes bankrupt, it's the Michigan taxpayer that gets tapped into. So that's why there's a certain degree of involvement that the state needs to look out for now, is to look out for the beneficiaries and the taxpayer.